Alright, what's up everybody? So, sorry for the poor quality. I'm doing this on my laptop because one, my camera is dead, and two, my phone is out of memory, so I can't take pictures or video now. So, that's cool. Um, but, yeah, so in my previous video I mentioned that I had my first gender therapy appointment coming up. And about how I was kind of nervous for that, but mostly excited. So basically, I want to talk to you about how that went because I had that appointment today, actually. So, start about last night, okay? So, last night on my way home from work, I got really pretty nervous about it, and then this morning I was even more nervous. I think it was more so one of the things just because, like, you're basically handing the power over to someone else and they get to decide whether or not you get a letter or when you get a letter. So I was pretty nervous about that. But I went in today. I brought a friend with me, first of all, and he actually came back with me. He is also trans. He went to a different therapist, though. So uh, let's see here. First of all, I showed up about 20 minutes early. The receptionist wasn't out there in the waiting area. Honestly, I don't even think she was there at all that day, today. Um, and then eventually, about 2 o'clock when my actual appointment was, the therapist came out, which she was in a session with someone else apparently, as well as um, the other counselor or therapist, whatever you want to call it. Uh, yeah, therapist. She came out. She had another one too. So it took a little while because they were basically being their own receptionist for the day. Um, but everything was started by 2 o'clock, which was okay with me. It would have been even better if I would have gotten the paperwork done and over with and then could have gone in. But I don't really care because of the way it actually turned out. So I was super nervous, really. And she came out. She was really friendly. She's like, she just sat down there, didn't even really say anything at first. She's like, "Hi, my name's Emily, and you must be." And she was actually looking at my friend next to me, like she was gonna talk to him, and he was gonna be her counselee, whatever you want to call it. I wouldn't necessarily say patient, but the person she was going to have the session with. And then he pointed over at me, and I was like, Taylor. So after we got all that figured out, she gave me paperwork. Um, I filled out the paperwork. It was super basic. Just normal stuff you would do at like a doctor's office or um, any other therapist. Although it was actually less than what I had to fill out at my doctor's. So, but basically, I filled it all out, took it back to her. My friend came back with me. We sat down, started talking. Um, Basically, she asked me what I wanted out of it. I said I wanted a T letter and eventually a top surgery letter once I could afford it, um, as well as to work through any problems that came up after I started T. Because I do believe that I may go back to her after I start T. Obviously, not very often, but if anything major comes up that I have issues dealing with, I'll probably go to her to talk about it because she seemed really nice. But I told her that first thing and right off the bat. Then we kind of just talked about like uh, uh, first she warned me about like all the therapist stuff, about keeping personal records and blah blah blah. After that, we got into basically kind of my coming out process, which that was more so what I talked about. It wasn't necessarily what she asked about. She asked me questions, but they were phrased differently, and that was the way I took them, so I answered them with those. Basically, I talked to her about my coming out process, very, very basic. It was more so what time I came out to who, that kind of thing. I explained to her that I am not out to everybody at work, but a few people, although I'm looking for a new job, so that's not an issue. I actually told her that I was looking into getting a job where my friend was, where he's working, because they're very accepting, at least more so than where I work, as well as it would be a better schedule for me because I could get stuff done during the day. And then after that, we talked about anxiety, depression. What was the other one? There's one other one, but it wasn't really like something I had dealt with. But we talked about how I'm anxious around certain times, being around groups of people, depression, how most of that was like my past, not really so much now. I gave her some examples of when I felt anxious and that kind of thing. She asked me like on a scale of 1 to 10 what blah blah blah. After that, we talked about, what did we talk about? Then she kind of asked me about what I knew about tea, what kind of changes I expected. Told her basically, I didn't really go into too much detail. I basically just explained I expect for this to happen, that to happen, blah blah blah. You gotta take with good with bad, like the acne, but you still get your voice to drop. Blah blah blah. And I knew those things because I had experienced the friend who was with me. He is 7 months on T, so I had seen a lot of that. And I flat out told her, I was like, you get the good with the bad. So I know it's not going to be like all happy-go-lucky. There are going to be some things come up that you don't necessarily want to happen. Like, I don't want any more acne. I already had enough acne for my life. I don't want more, but I expect it. She explained, yeah, basically I knew what I was talking about. It was just second puberty, that kind of thing. She talked to me about if I knew anything about the, like, history of trans. I told her I didn't really know a whole lot, although I knew that it had been known since mankind started and that kind of thing. I told her very basic what I knew about it, and she's like, yeah, that's fine. I mean, if it's not something that interests you, it doesn't matter. You don't have to look into that. She told me about a couple different groups who meet here. I actually already knew about one. I just haven't had a chance to go, and I explained to her that I hadn't had a chance to go because of my work schedule, which is also why I'm looking for a new job, because I don't really have a chance to do much of anything. After that, we talked about I don't know, we talked about a lot of stuff basically, and then she gave me a homework assignment, basically to write an autobiography, but it's more so detailing like the things in my past childhood all the way up until now that kind of were like signs that, hey, you're trans or you're different, that kind of thing. I asked her like how far back this needed to go. She said as much as you can remember, it doesn't matter. It's more so she just wants to know like leading up until then, what were the signs, that kind of thing. And I asked her, I was like, I don't really remember a whole lot of my childhood, so yeah, about that. She said just write as much as you can remember, and then like anything that you've been told or anything like that. Sorry. So, yeah. Other than that, she explained to me that since I was under 22 22. I want to say 21 or 22, since I was under one of those two ages. Normally they would send me to Children's Research Hospital, I think. I don't remember. To a certain person rather than a endocrinologist, basically off their list. And that was when I explained that I had already talked to my doctor, and that my doctor just said that we needed a letter. She said that that was okay. She just needed to get my doctor's contact information to make sure that like my doctor knew what they were talking about, as well as they have to fax over legal stuff, blah blah blah, to make sure that they're eligible to do it and they know what they're doing, which I don't think will be a problem at all, with the fact that my doctor like immediately said that it was okay. So I'm assuming that she would know what she's talking about. And then she explained to me that she doesn't see any reason why I shouldn't get my letter basically next appointment. She said she likes to have 2 or 3 appointments. She's not there to hold you back from starting tea or anything like that. She's not trying to keep you 3 years before you get to do anything. She's really just there to make sure that you're making the best decision for yourself. That kind of thing. I don't know. I felt like most of it was her basically asking me questions about what I knew about being trans and to make sure I knew what I was getting into, that kind of thing. I don't know. So, for my next appointment, it is August 4th. It is going to be $100 instead of $50, which that's okay because she said that normally she charges $125 for an hour. So she already dropped it $25, as well as my first visit was only $50. So yeah. Although I need to call and see if I can get a receipt for today. She didn't give me a receipt, which from my understanding, I'm able to send that receipt into my insurance company and get reimbursed for it. So, yep. That's what I gotta do. Gotta get my receipt so I can send that in. I got to write this paper thing. I'm kind of thinking about just doing bullet points, but she said that she's not really the type of therapist who wants to sit down and talk to you and then make you pick out every little thing from your past. So I don't think she really wants to talk about it a whole lot. I think she wants me to just get it out there in the open and recognize that there were signs leading up and that kind of thing. So I gotta do that. Gotta get my receipt, and then I gotta get $100 for my next visit, which I scheduled it right after I should get paid, as well as I'm doing it this way so that my friend can come back with me, because he is actually trying to find a different endocrinologist, because the one he went to didn't do blood work or anything when he first went in, which is what we found really strange, as well as that doctor's staff was really kind of rude, just in general to people, not necessarily just to trans people, but just in general. So he's trying to find a different one, and my therapist told me that she would get him a list of those. So, yeah, now that I've rambled on for 14 minutes, I was really excited to talk about this, mainly just because of the fact that once I get all this done, hopefully I'll get a letter next session. If not, I believe we'll finish that session and then she'll write it up for me, and I can probably just go pick it back up, because we actually met someone in the office today when we went in. He came in and he was just waiting to get his letter. He picked it up after she printed it out and walked out. So, yeah. I know I'll have to pay for this next visit, and hopefully I won't have to pay for another one after that, because I'm ready to start tea so badly. And yeah, I'm just excited. Which also, side note, since I shaved my head off, I've actually been passing a lot more, which is kind of strange to me because I don't really feel like I pass very well. Mainly because of this chubby face, but yeah. And then another side note, which I'm also pretty excited about, is I took a picture the other day and posted it on Facebook, and my sister-in-law, I guess you could call her, my sister's husband's sister, so my sister's sister-in-law, she commented, or she screenshotted it, and then, like, drew circles around my, like, cheeky, like, side of my face, whatever you want to call that, and she's like, your jaw is so structured. I'm serious, guys would kill for that. So I don't know. It was like the highlight of my day, but whatever. Generally only when I take pictures or when I do this, because you can see it right there. But yeah, so I'm gonna go, and I probably won't post another update until after my next gender therapy session. Hopefully I get my letter. Super excited about that, although I'm not really sure what I'm gonna write in this letter, just because I don't really feel like thinking about it right now. Yeah. But from what I understand, the other therapist who's there, which is her supervisor, she makes people read books on it, as well as basically do a whole lot of shit. So I'm very thankful that I don't have to do that. I don't know. I mean, in general, I think it's really fast for me to get a T letter from a therapist, although I'm not going to argue with it at all. But, I mean, she seemed to recognize that I knew what I was getting into and knew what I was talking about, so yeah. But I'm going to go because this video is super long and I don't even know if it's going to upload now, so bye, guys.